check on you today.
Okay.
All right, so I can see that she is spontaneous, her eyes are open, and she's responding back to me fine. Can you tell me where you are right now?
I'm at the doctor's office.
And why are you here?
I'm getting a physical.
Okay. Now can you click the pin for me 2 times? Okay. So then I can see that she obeys command. So her Glasgow Coma scale is a 15. Next, I'm going to observe her posture and position. She's sitting up in the chair, upright. She's not to one side or the other. She's just perfectly sitting there. Her general appearance is good. Her facial expression is fine. She doesn't look angry or upset or drooling, anything like that. Do you have any pain today?
No.
Okay. I'm going to check her vital signs now. Her vital signs were heart rate 98, blood pressure 130/70, respiration rate was 17, temp was 98.7, and her O2 sat was 98. Next, we're going to check the cranial nerve number 2. I'm going to check her eyes at this point. I'm going to do her peripheral vision, so if you can cover one eye for me, and I'm going to hold up numbers in your peripheral field, and you're going to tell me what numbers you see, okay?
Okay. 2, 1, 4.
Okay. Now the other eye.
1, 2, 3.
Good job. Next, we're going to do a Snellen chart. This is 20 feet away. If you could just read the last line you can read.
DEFPOTEC.
Good job, and that was 2020, so she's good with that. Okay, next we're going to check cranial nerve number 8, and this is hearing, so I'm going to have her cover one ear, and I'm going to whisper in that side, and she's going to tell me what she hears.
Hello.
And now cover the other ear.
Goodbye.
Good job. Okay. Next, I'm going to test her recent and remote memory. So, can you tell me what you had for breakfast this morning?
Yogurt.
And what did you do last year for your birthday?
I went to Mexican.
Okay, good job. Next, your speech pattern and difficulties. So, this is cranial nerve number 10. I can tell she's speaking to me fine. Can you just go ahead and swallow for me? Okay, she swallowed fine. Next, while we're in this area, we're also going to check her glossopharyngeal, which is her gag reflex. So I would use a tone depressor and just have her open her mouth, and I would hit the back, and she would then gag. If not, it would be bad because we want to see the gag reflex. Next, we're going to check the rest of the your cranial nerves that affect your eyes. So this would be 3, 4, and 6. So the first one we're going to do is the 6 cardinal fields of gaze. So I just want you to focus on the tip of the pin here. The whole time just keep looking at it as I go to the fields, okay?
Okay.
Okay, she did good there. Focus on the tip of the pin again. I'm just going to move it into her nose. Good, and that test, what I'm observing for is any shakiness in her eyes. Okay, next. Okay, the next we're going to check cranial nerve number 7. This is with her face and her movement, so I want you to smile for me. She smiles, frown, and then puff out your cheeks. And she did that good. Next, we're going to do a Romberg's test, and this is checking cranial nerve number 8. So we're going to do the standing version. So she's going to stand up with her hands by her side. She's going to keep her eyes open at first, and I'm going to see how long she can stand here. So she can stand here for a large amount of time without falling or anything, so she's good there. Now we're going to close her eyes and see how long she can stand here. And she can also stand well, not falling over anything for an extended amount of time. So you can go ahead and keep standing actually. So now we're going to do the gait assessment. So I'm going to have her walk 10 feet and turn around and walk 10 more feet. And you're good to go. So she's not swaying, not falling, nothing. She's arms are swinging by her side. She's good there. Next, we're going to check her muscle tone. So if you could squeeze my hands for me and then push against them and pull back. And then with your feet, Can you push up against him and push down? Good. So her muscle tone is good and her pedal pressure is good. Next, I'm going to check her cranial nerve number 5, and this is her jaw. So I'm going to put resistance under here, and she's going to open her mouth. Should you get there? Next, I'm going to check her deep tone reflexes, and with this, we're going to check the Babinski's reflex, and this is a reflex that you see in babies, but adults grow out of it, so you want it to be negative in adults. And what we're going to do is just go along the bottom of the foot here and curve up around the toes, and you would see her toes would curl if it was positive. So we'll just do it one more time. Around, and they don't curl, so she's good. And that is it.